I'm Alice. Welcome back to Men Health 30, where we don't shy away from the truths about men's health, especially sexual health. If you're a man over 50, you might be wondering whether your habit of masturbation could affect your sexual health. Can it bring benefits, or does it cause harm? Let's dive into this topic, especially in the context of the COVID-19 pandemic, when social distancing measures and daily routine changes have significantly altered the sexual lives of many people. The pandemic didn't just impact physical health, it also changed sexual habits, not only among the younger population but also in older adults. One of the most noticeably affected groups is men over 50. Social isolation, combined with changes in daily life, has led to a significant increase in habits like masturbation, especially when patients isolate themselves from society. This becomes even more important when we understand that this group of men is undergoing major physiological changes, such as declining testosterone levels and cardiovascular health issues. You'll surely want to know more about how masturbation might affect your sexual health at this stage of life. Does this habit truly offer benefits? Or is it quietly doing more harm than you think? Let's find out together, because the truths behind it might just surprise you. If you're over 50, you may have wondered whether masturbation and the consumption of pornographic content can affect your health, especially as your body is undergoing important physiological changes. As you enter this stage of life, the decline in testosterone levels and changes in cardiovascular health can increase the risk of conditions such as andropause and erectile dysfunction. However, there is currently very little research showing the long-term effects of masturbation or watching pornography in older adults. That said, as the body changes, every habit can have a profound impact on sexual health. This requires careful attention and mindfulness in how these habits are maintained. Masturbation, whether or not it involves the use of pornographic content, can in fact worsen conditions like erectile dysfunction, premature ejaculation, or delayed ejaculation. It can also make it more difficult for men to reach orgasm during real sexual intercourse. When masturbating, men stimulate their bodies to achieve pleasure. But this is completely different from having sex with a partner, both in terms of intensity and frequency. The sensations and pressure from self-stimulation cannot be replicated in a real sexual relationship. Similarly, the use of pornographic content is artificial by nature, merely visual stimuli that cannot be recreated in a real-life sexual relationship. This can lead to reduced sexual desire, making it harder for men to maintain interest when with a partner. These factors are not just theoretical, they're supported by scientific evidence, clearly showing the long-term effects these habits can have on male sexual health. Masturbation allows men to achieve pleasure through self-stimulation, but these sensations cannot be replicated during actual sexual intercourse with a partner, as the intensity and frequency of self-stimulation are completely different from the physiological pressures involved in real sex. Similarly, the consumption of pornographic content, which consists of artificial and unrealistic stimuli, cannot provide the same experience as a real sexual relationship. These images and scenes are designed to stimulate only visually and do not create the emotional or physiological connection necessary in actual intimacy. As a result, men may experience a decline in sexual desire as the stimulation from masturbation and pornography fails to maintain satisfaction within real-life relationships. In addition to erectile dysfunction and ejaculation disorders, excessive consumption of content from the pornography industry can have other negative impacts on both the sexual and psychological health of men. However, these effects do not always occur and can depend on various factors, including social context, overall health status, and how these habits are practiced. When the habit of masturbation or pornography consumption becomes compulsive, an uncontrollable urge, it can negatively affect personal relationships and work life. This not only reduces quality of life, but can also lead to more serious problems. In such cases, When the behavior starts to intrude on and dominate daily life, it may be a sign of a disorder, and the individual should seek medical help for timely intervention. The impact of these habits on sexual and mental health is significant, and professional support can help restore balance to one's life. Excessive masturbation can have negative effects not only on physical health, but also on mental well-being. One of the risk factors associated with this habit is emotional disturbance, including anxiety, chronic stress, and even depression. This should be clearly understood, as masturbation and related behaviors can impact psychological health if not kept under control. In addition, there is a common myth that frequent masturbation and ejaculation can help reduce the risk of prostate cancer. Many believe that a higher number of ejaculations acts as a protective factor against the disease. However, the truth is that there is no strong scientific evidence or large-scale clinical trials proving this link. Therefore, masturbation has not been proven to be a preventive measure against prostate cancer. Another myth claims that masturbation increases sexual desire in relationships. In reality, excessive masturbation may reduce natural sensitivity and gradually diminish a man's interest in real sexual intimacy with a partner. If this starts affecting your sex life or marriage, do not hesitate to seek professional help. Timely intervention can resolve the issue and restore balance in your sexual well-being. An important point to discuss is that not using the penis regularly can cause concern for some patients, especially when they feel that reduced sexual activity and the choice of masturbation are associated with consuming pornographic content as a form of substitution. However, masturbation cannot be considered a solution for penile disuse or atrophy, especially in men over the age of 50, a high-risk group. Instead of relying on masturbation as a form of treatment, we can recommend that these patients adopt more effective therapeutic approaches, such as pelvic floor physical therapy, vacuum erection therapy, and pelvic floor exercises, Kegels. These exercises help strengthen pelvic muscles, improve blood flow and vascular health, thereby supporting sexual function and preventing penile atrophy. These methods not only improve pelvic health, but also help patients maintain sexual function naturally and sustainably. If you're over 50, you may have noticed that some things just aren't the same anymore. And if masturbation has become a regular habit, it might be creating mental pressure, making it harder for you to perform when it matters most. But don't worry. The good news is there's a natural, safe, and fast way to restore your sexual power just like when you were in your 20s, without pills or expensive treatments. With just a simple 7-second daily ritual, based on a powerful scientific discovery, thousands of men have regained their erections, intense desire, and confidence in the bedroom, even well after 50. If this sounds helpful to you, go ahead and click the first link in the comments to watch the full video. If you enjoyed this video, don't forget to like, share, and comment so we can keep bringing you more valuable insights. And make sure you don't miss the next video, where I'll be sharing even more powerful tips to naturally boost your sexual health.